I want to take the opportunity before we go to just consolidate some of the work that we've done today in our discussions. We've covered a lot of ground concerning the health of women today, discussing the disease burden for conditions that disproportionately or uniquely affect women, key insights for establishing and maintaining successful partnerships, how institutions must champion transformative policies and practices to ensure healthy bodies and workplaces for women, and opportunities to address research and development gaps within and across borders. When we leave here, we want to continue the conversation and implement these great ideas. And so I'll end as we did last year. I gave a similar charge as a 1, 2, 3 charge. What is at least one immediate action that you can take to address women's unique health needs within your sphere of influence? Because we all have a sphere. And identify 2 resources or organizations that you can include on your go-to list for reliable information to assist your efforts. And then before you leave, write down at least 3 potential partners who you will reach out to within the next 60 days, or at least by the end of 2025. And so I want to thank all of our speakers that have spoken today throughout our program. It has been absolutely amazing. We thank you for providing your welcome insights, and for the audience for being very engaging and interacting. We also want to thank, and here is all of our speakers. We want to thank our sponsors of this program, Novo Nordisk, for their support for today and tomorrow's program, as well as O Positive Health, Johnson & Johnson, and OnaWave Medical for elevating special topics in women's health this morning, and Cencora for sponsoring our afternoon's lunch, as well as to our media sponsors, Biology of Sex Differences and Springer Nature. Thank you to the UN Science Summit and its organizers for the opportunity to participate in this year's program. We look forward to continuing partnership, and CURE for hosting us in this wonderful space. Last but not least, to our powerhouse team that has worked diligently and masterfully to execute this event. We have our Global Health Connector team, especially Alejandra Rodriguez, Maria Luquette, and Iman Amar, led by the fearless Heather Smith and Bledden Reese. And then we have our SWHR team with Sarah Chu, Monica Lefton, and all the volunteers on the ground today and virtually that have helped to implement this program. As we close for day 1 of this Global Health Connector program, remember to keep the momentum going in your future work, and everyone is invited to return tomorrow for programming on the power of convergence, enabling the prevention and management of obesity and related non-communicable diseases. This session is going to highlight the urgent need to address obesity as a global health challenge by bringing together leaders in health, science, finance, and policy to explore how convergence can unlock new models for prevention, funding, and systemic change. It starts at 9 o'clock in the morning in this same location. And so you can join online, and if you are here and you did not register, you can see Heather Smith. She's in the back waving her hand, and we can handle that. And so remember to also come with your name badge tomorrow. So thank you to everyone for participating in this women's health program in New York City and online, and thank you. Have a blessed day.